Welcome to Wildlife Rehabilitation from Rescue to Release, a podcast dedicated to licensed wildlife rehabilitators and the veterinarians who support them. I'm your host, Gail Buhl. Techniques we discuss here are meant for licensed wildlife professionals. If you aren't licensed and trained for wildlife rehabilitation, do not attempt to capture, hold, or rehabilitate any wild animal. If you find an injured wild animal, a wildlife professional can recommend next steps. We will tackle topics about rescue, care, management, reconditioning, and releasing wildlife found in North America. This is a deep dive into each subject. We hope to give rehabilitators information they can use because they're already going to great lengths to rescue and nurse animals back to health. There are three possible outcomes in wildlife rehabilitation: release, euthanasia, and placement. An injured or orphaned wild animal's journey to restored health and independence in their natural habitat is delicate and complex. We draw techniques and expertise from many disciplines. Many animals brought into rehabilitation cannot be saved. The last gift we can give them is humane euthanasia. We'll talk more about when this is necessary. Sometimes animals are deemed non-releasable and evaluated to be suitable for a life in captivity. When that happens, we shift to a long-term approach to managing their care, training, and housing. Some such animals serve as ambassador animals, a term for animals that rehabilitators use to educate the public. Each episode, we'll speak with experts who represent specialty topics across the profession of wildlife rehabilitation, ambassador animal care and management, showcasing best practices. Hello everyone, and welcome back to another episode. Today we'll cover an animal that calls the Pacific Northwest coastline home, the harbor seal. My guests this episode seek to improve the lives of harbor seals and other marine animals at their organization SR3. Now, SR3 is located in Washington State, and it stands for Sea Life Response, Rehabilitation, and Research. Dr. Michelle Rivard is the veterinarian of record for SR3, and Casey Mclean is the co-founder of SR3 as well as a veterinary technician. We'll briefly cover SR3's Dr. Michelle Rivard and Casey Mclean's origin stories, and of course more on SR3, how and when it was founded, how it got its name, and a bit more on the important work they're doing now. This is part one of two with guests Dr. Michelle and Casey. This part, we focus on harbor seal intake through preparation for release. Now let's dive right into it. I am very excited about this because I rehabilitate in the central part of the country in Minnesota, and so I'm not on the coast, and SR3 is all about marine mammals. So welcome, and for everybody, Dr. Michelle Rivard, I'll have you introduce yourself first.
Thanks, Gail. You can call me Michelle as well.
Okay. Thank you.
I'm originally actually from the Midwest as well. I'm from Michigan. So I graduated veterinary school from Michigan State and was always really interested in aquatic animals and aquatic wildlife, and wanted to try and figure out a way to sort of make that my career path. After graduating from veterinary school, I spent 4 years in the Army Veterinary Corps doing mostly small animal or companion animal medicine, military working dogs, food safety, public health, but always really wanted to come back to aquatic animal medicine. So after my time in the military, I spent a year, I did an internship at Mystic Aquarium in Connecticut. So they're working with the collection animals as well as the animals that stranded and came into care at their wildlife rehab center. After that, I spent 2 years at the Marine Mammal Center in Sausalito, California, doing pretty much exclusively marine mammal rehab and free-ranging wildlife. So we would get stranded pinnipeds, as well as cetaceans and sea turtles. So spent 2 years there before moving up to Seattle to take the job as veterinarian here at SR3.
Wow. What a journey. Oh my goodness. Yeah. And you had that goal in mind. So you just kept finding, I would assume, just opportunities here or there to say, ooh, that gets me closer to my goal.
Yeah, and it was nice to have that strong foundation in small medicine or companion animal medicine as well, just because it really helps to have that high of a caseload and build that strong foundation before moving on to marine mammals, because they have some unique physiology and adaptations that are a little different than those terrestrial species. But it's nice to
Right.
have that strong foundation first.
Right. Excellent. Oh my goodness. Thank you. Casey, what is your origin story?
Yeah, well, thanks for having me today. I'm excited to talk to you just as you are to us. But as far as my background, I was an East Coaster. So I went to University of Tampa with the idea in mind that I wanted to do marine biology. I always kind of thought I would go more the research route, and I did start doing that through college and shortly after. But at some point in there, I was kind of introduced to the world of rehabilitation for marine mammals and thought, oh, that's interesting. But I didn't have any kind of medical background at the time or even thoughts of trying to get a medical background. So I stuck with research for a little bit. And then, that was typically contract work as a recent graduate from college and stumbled into a veterinary assisting position when I didn't have work. And I fell in love with medicine and decided that I would like to try and combine those somehow. And from there on, I just started taking a lot of jobs and internships in marine mammal rehabilitation. And eventually in 2010, I moved out to the San Juan Islands in the Pacific Northwest. And I think I was rather in shock that there were no resources here or extremely limited resources for marine animals when they were sick or injured on the beaches, particularly for threatened and endangered species. I did not set out to start an organization, but I am a co-founder of SR3, and it just sort of happened because I was upset and thought there should be something to help these animals, and people start telling you, well, you should do that. So myself and many others that have come along the way were really what built up SR3 to make this resource for the region that is the first of its kind here.
Oh, wow. And a little later, I definitely want to delve into a little bit about like how long it took and what kinds of, I don't want to say hoops, but how to develop something like
yeah,
this.
there were lots of hoops.
Hoops. Lots of hoops. Yeah,
Hoops that were on fire sometimes.
Right. Some of them around. Oh my goodness. So and we're going to get into a little bit about the background of SR3 in particular, but when did SR3 quote unquote start?
I started the organization in 2011. So about a year after I'd been in the Pacific Northwest, I formed a business, and it was extremely grassroots up until 2016. Okay. When we were fortunate enough to find an angel donor that really wanted to get our programs off the ground, and did that. So we had a couple of field programs. We had an ambulance to kind of think of it like a MASH unit, some field care, but we were driving animals all the way down to California that needed longer term care, and many animals just didn't have any options at that point.
Right.
And then we were able to build a hospital and open that in April of 2021.
Okay. Yeah, relatively recently. Yeah, a long time to get it developed. Yeah, I think that's also a very interesting thing. So, like, I'm an in-home rehabilitator, right? But and I do a lot of work with the Raptor Center and the Wildlife Clinic here in Minnesota, and it wasn't like an overnight thing. It's a journey. It's a long journey. SR3. What does that mean?
Stands for Sealife, Response, Rehabilitation, and Research. And those are the three words you will often find in our federal permitting requirements and language and things like that. So that's kind of a very standard 3 R's that a lot of marine mammal rehabilitators participate in.
Okay, excellent. I mean, I love the name. It's nice and short, and it's catchy and everything. I wanted everybody to know what it was about. And later on, again, I want to explore that just a little bit more because each one of those has significance. But one of the reasons that I really wanted to talk to you is I wanted to talk about marine mammal rehabilitation. Most rehabilitators in the country, and I would imagine around the world, this is an area of rehabilitation that is, I don't want to say mysterious, but difficult and not your regular type of rehabilitation. So we talked earlier that maybe what we would do is kind of look at a couple different species and kind of almost walk them through the rehabilitation process so people can have a little bit better understanding. And one of those species is harbor seals. So who would like to talk about harbor seals? We can talk about natural history. We can talk about how come they come into rehab and kind of what that rehabilitation looks like.
Yeah, maybe it makes the most sense to start off talking a little bit about their natural history, because that kind of dictates the animals that we see strand, as well as the care that we provide for them, as well as the seasonality too. Yeah, so harbor seals they're a true seal or a phocid versus the sea lion. So they're part of the true seal family versus sea lions, who are part of their odoriids, or not true seals. They're part of the sea lion family. So harbor seals don't have those external ear flaps, and they move around on land kind of like an inchworm, versus the sea lion that can actually rotate their pelvis underneath them, and they can ambulate on all four flippers or walk around on all four flippers. So the sea lions are much more agile than the harbor seals.
Okay.
They are one of the more common marine mammals in the U.S. So they're found all along the West Coast and the northern part of the East Coast. They are pretty ubiquitous here in the United States, as well as in Europe as well. And they're a little bit unique in the sense, or they're a little different, I should say, than some of the other species we may work with, because they're non-migratory. So they're the local species that sort of hangs out in the area year round, whereas a lot of the odoriids and even the rest of the phocids we see here on the West Coast, like elephant seals, they'll undergo these long migrations, come to a rookery to breed and pup, and then disperse and then come back each year. Whereas the harbor seals are very much more a local species. So they're here in Puget Sound in the Pacific Northwest, and we see them year round.
Okay. A quick question before we go on more detail about harbor seals is in the Pacific Northwest, you've got the seals and not seals. But how many different species are there, whether it's seals or not seals, kind of combined? Is there quite a few?
Yeah, if we're talking about pinnipeds exclusively, we see, so of the true seal groups, we see the harbor seal, the northern elephant seal. They tend to breed on rookeries in California, but we will see sometimes subadults and adults up in the Pacific Northwest. And there's actually one family that has pupped up north on Whidbey Island. So there's at least one lineage up here where there's a mom who's pupped, and her offspring have also pupped up here. So we have the elephant seals, the harbor seals, and then we also see California sea lions, northern fur seal, Guadalupe fur seal, and stellar sea lions for pinniped. Did I miss any, Casey?
No, I think you caught it. So about 6.
That's 6 different. Wow. See, I was going to learn a lot. It's going to learn a lot. Okay, so let's drill down then again with the harbor seals. So what is it about harbor seals? I mean, they're relatively common. I put that in quotations. But what is it about them that gets them into rehabilitation?
I guess I would say their adorableness, unfortunately, sometimes.
Oh, they're cursed with being cute. Yeah. Okay.
It's hard to take a nap on a busy beach when you're so cute. So that sometimes gets them into trouble. Okay. But all kidding aside, I think that, this is an animal that there's a lot of, as Michelle mentioned, in our region. And so they have I won't say the ability, but they tell us about the health of the Salish Sea because they're impacted by so much of what we're doing. So whether that's they're showing up entangled in trash or fishing gear, they are getting picked up by sometimes well-meaning people who just don't understand that they are resting on the beach and that's natural. Sometimes they're just kidnapped outright. They might be attacked by a dog. We're seeing, increases in parasites, which potentially could be related to their immune systems decreasing, maybe due to toxins in the water. or parasites becoming prolific from our increasing water temperatures. So I think that there's a lot of factors, boat strikes, gunshots. So there's all kinds of things out there that can really bring them into rehabilitation. And sometimes we're able to pinpoint what that is, and sometimes we can't. We just know that they're sick or injured, and they need medical care.
Mm-hmm. So a lot of the things that you listed are very common to everybody that's listening now. Same thing with me, right? I mean, it's all those anthropogenic things. We put things in front of wildlife. We put obstacles in front of wildlife all the time and don't think twice about it. Mm-hmm. And then sometimes being malicious, like you said, shootings or things like that are so very, very similar, but in a very different environment.
Yeah, and I think that's a really good point you make, Gail, because I think that's one of the things that shocked me being, I was moving from the Southeast to what I thought was this, so environmentally friendly and green and progressive environmentally area. And I was kind of shocked that bunnies and squirrels and deer and other terrestrial species were getting more care than these animals were. More care and attention. Not saying they don't deserve it. They absolutely do. Sure. But I think I was just a bit surprised when I arrived and discovered that was the case when they're facing the same issues. And the oceans are just so important to all of us, not just the harbor seals. Mm-hmm. So yeah, as you mentioned, it's an indication of what's happening in our environment. I hesitate to say canary in the coal mine, but a lot of people are not going to recognize that reference anymore, but but it's a little bit like that. So, all right. So we've got our imaginary harbor seal, and I'll let you pick what happens. And then let's see what happens to this harbor seal going into rehabilitation. Okay, wait, Michelle, I'm going to give you the case.
Oh, okay. Oh, this is even better. Okay, Casey, I'm listening.
I'm a harbor seal pup on Alki Beach, and I've been observed for 2 days. My mom's not around, and I'm moving funny, and my eyes are squinty. What happens to me, Michelle?
So one thing that I don't know if we got to touch on this in the natural history part, but one thing that is that we see with the harbor seal pups, dissimilar to terrestrial rehab, is there a lot of maternal abandonment. So in the wild, harbor seal pups should nurse from mom for about a month or so. And if they're separated from mom for one reason or another, one of the many reasons that Casey mentioned, they don't know how to forage on their own. So they essentially will starve and die of malnutrition. So here in Washington, we have a little bit of an extended pupping season. So the harbor seals will pup on the outer coast of Washington, usually May to June, so late spring, early summer, and then down into Puget Sound late summer and into the fall. So like Casey mentioned, the harbor seal pup in West Seattle, sometimes we'll see pups that late in that area as late as September. So we have kind of this extended season. So that's a large portion of the animals that we see in care are ones that are separated from their mom, aren't able to forage on their own, and are thin and malnourished and dehydrated. So that's probably the case of the one that he's talking about.
Okay, so clarification question. So if a call comes in and someone says, well, it's a young harbor seal on the beach, do you say, okay, we'd like you to monitor it for 2 days before we decide it needs to come in? Because not all of them need to come in. So what is that? How do you either help the finder, or do you say we're sending somebody out just to assess? How does that work?
Yeah, so typically we want to have someone, depending on the region and who holds that response permit, to go out and assess that animal. Okay. So if we determine that it is a pup that's been separated from mom, if it's already looking a little thin, some of those issues that Casey mentioned. So sometimes we can see eye problems. Sometimes we'll see wounds, whether it's from wildlife or dogs, bite wounds. So if an animal has any of those conditions, then that's usually one that we want to come in right away. Especially if it's an animal where there's no sign of mom and it's looking really thin and dehydrated. If the animal looks like it's in good body condition, is relatively alert, seems to be a little bit more well hydrated, then those may be animals that we monitor. So it kind of depends on the animal's age and the condition, and the location as well. So there are some beaches in our area that are notoriously busy with a lot of people and a lot of off-leash dogs, where mom is very unlikely to come back if she abandoned her pup.
Right. Okay. And this is just a clarification. I think I've picked this up just through the conversation, but harbor seals don't have like a rookery where they would have, lots of the females have lots of their pups in the same space. Is that's true?
Yeah, I mean, they do form colonies. There are some areas that are a little bit more ideal harbor seal spots, so some like rocky outcroppings and stuff, but they don't form large rookeries and colonies to the extent that California sea lions or stellar sea lions, or any really northern fur seals, northern elephant seals. They all come together a few months a year to breed and pup in huge numbers, whereas the harbor seals don't do that.
Right. Okay. Thank you for that clarification. That's what was picturing in my head, but of course I've got the National Geographic videos in my head of just all of these elephant seals or sea lions, and all the noise and all that kind of stuff. So I'm like, gotta get that figured out. All right. So go ahead, Casey.
Oh, I just wanted to touch on a little bit about the stranding network since Michelle brought it up, in case people aren't familiar with what that is.
Yep.
So unlike the terrestrial facilities where they're constantly getting calls from the public, we certainly get calls from the public, but we have a stranding network of mostly volunteers, that's overseen by the federal government. They all have permits to go out and assess these animals, and they cover different areas. So when a call comes in, we're coordinating with them to say, hey, can you go look at this animal and determine if it needs help, which I think is very different from the terrestrial world, where they might say, okay, Bob, pick up that bird and bring it in. We can't do that with marine mammals.
Okay.
One, because of their size, but also two, because it's illegal. So.
Right. Excellent. Thank you for that clarification. And we're going to definitely dive into permits later too, and all the different kinds of permits you need in the different areas, which complicates doing, I think, marine mammal rehabilitation as well. So thank you for that clarification. So we've got someone was assigned to go out, take a look at this pup. Did we decide it was a pup? Okay, it's a pup.
Sure.
and it needs to come in for care. So how does that happen? And then what does it look like once this little guy gets to SR3?
So once the responder deems that the animal needs to come in for care, we usually have for a harbor seal at least 2 people go out on a response to get that animal safely into a carrier. So we make sure that we wear PPE, gloves, boots on the beach. We'll kind of towel the animal, at least wrap a towel around its head to keep it from biting us. Pick it up and put it in the carrier. They're usually not very amenable to being scooted around and stuff. So you usually have to pick them up and place them. So they go in a carrier. We have a couple of transport vehicles. One is an open air truck and one is an ambulance that's enclosed, and we can regulate the temperature in the back. Okay. So for a harbor seal pup, especially one that's relatively local, we can usually transport them in the back of a pickup truck or a vehicle. But if we ever have a species that we need to make sure that we sort of control or climate control for, we have the ability to do that as well, depending on the weather. So pup gets in the carrier, makes its way to the rehab facility. We have a staff here, so Casey, myself, as well as animal care staff that can assess the animal when it gets here. But the most immediately life-threatening thing that we tend to see in these malnourished harbor seal pups is hypoglycemia. So their blood sugar can drop fairly quickly. Normally with mom, they'd be nursing kind of around the clock. So if they're left for an extended period of time, and especially if they start to become really compromised and malnourished, we can see that blood sugar drop. So the priority with them is making sure that they are hydrated and that we get some calories into them.
Okay.
So that's typically what we do when they first get here. We try not to handle them too much. If they have bite wounds or things like that, we'll give them some pain medications, but we kind of just want to give them some hydration, some nutrition, and leave them alone and let them chill so that we're not stressing them too much. So then we typically wait and do an admit exam, thorough admit exam the next day, after we've given that animal a little bit of time to stabilize.
Okay. And again, that's very similar to what you do with any injured animal. Some of the circumstances are slightly different, but yeah, very interesting. So one of the things that you mentioned is PPE for when you're gathering these animals off the beach. Part of that certainly is for your safety, right? Because you don't want to get bit or anything like that. But do you have to worry? Diseases currently, of course, are the thing that are top of mind for everybody, which they should be in rehabilitation anyway. But are there things that either people have to worry about, either zoonotic diseases or reverse zoonotic, or we might be giving them something? Do we have to worry about that at all, Michelle?
Yeah, I mean, there are a fair amount of zoonotic diseases that we can see in marine mammals. So any sort of GI parasites, those are zoonotic. Leptospirosis, which is a bacterial disease that can cause kidney failure. That is something that are less likely to see or unlikely to see in a harbor seal pup quite frequently in California sea lions. We had a couple of cases of elephant seals this year. So that's something important. They can, if you get bit, they can transmit some pretty nasty bacterial infections, bite wounds. As far as everybody asked about COVID and the pandemic, and there hasn't been a case of COVID-19, I should say, in pinniped, which is good. So that's something that we're less concerned about. More recently, this isn't zoonotic. Well, at least it hasn't jumped to humans at this point. But more recently, there's an unusual mortality event declared on the East Coast due to avian influenza. So we know that that's affecting our poultry nationwide. But then it also jumped to the seals and the pinnipeds in New England area. So they had a lot of harbor seals as well as some gray seals that died due to avian influenza. So again, not zoonotic, at least not humans. It's actually test from him. But just something to be aware of as well.
Yeah, avian influenza. Yeah. HPAI. That's that one's a tough one, and that's even tougher thinking because I know that it's been found in bears and fox and skunk and opossum and then of course lots of birds and because that's where it originates. But thank you for that little kind of slight detour. So we got the call, the person that is volunteering for the stranding network says, yes, this animal needs to come in. You send out the ambulance, let's say, and then the animal, what kinds of things do you need to get ready at the center to receive? So I'm assuming holding, I'm assuming, of course, medical stuff. What kinds of things, how do you guys prepare?
Once we know an animal's coming in, it's going to depend on the size of the animal that's coming in, of course, as to what you're preparing. But in general, for harbor seal pups, it's a small holding enclosure. We call it a tote. If you've ever seen live fish transported, it's kind of this little 2 to 3 foot deep tote they can be in. And that's where they're going to stay until they're stable for sure before they go out to the larger pools. Those can be filled with some water if we want them to have shallow swims. But in general, they're going to be in there on a grate bottom so that, they're not sitting in any of their poop or pee or anything like that. And then we can put a heating pad in there or a heat lamp if we need to. Generally, we're going to be getting both subcutaneous fluids as well as a electrolyte tubing or oral tubing ready for them. And then just being prepared in case we do have somebody that's coming in with a crashing glucose or some sort of massive wound that might need something immediately. And of course, just always being prepared to do a quick look over and see, is this a case that needs immediate humane euthanasia?
Right. Right. Okay. Okay. So that yeah, that makes sense. And again, pretty similar. I mean, but just differences in types of enclosures and things that you are putting them in, but very, very similar. Okay. So let's continue on with our harbor seal baby. So what's next in our scenario?
I think that's going to be Michelle mentioned the next day is going to be the intake exam.
Mm-hmm.
And that's really more her part. So Michelle, I don't know if you want to speak to that and kind of how you go through an intake exam.
Yeah. So for routine intake, usually the first thing we'll do is we'll draw blood from them. So we don't, especially these malnourished animals, we don't fast them. We want them to get their food and their calories. So we don't necessarily see a ton of issues with our blood values if they're not fasted. So we'll get our blood work from them first. And then we do kind of just a thorough once over from the tip of their nose to the tip of their tail. We collect morphometrics. So we get a standard length, which is again, tip of nose to tip of tail, straight length on them. We sect the animal. We look at eyes, see if they have any issues there. We look at their teeth, see if they have any tooth eruption, because that can sometimes give us a clue on the animal's age, or at least help to determine how old the animal is. We listen to their heart and lungs. It's not uncommon for some of these animals to have pneumonia, or even some of the very young animals will have a murmur, which will typically resolve if unless they have some sort of congenital heart defect. Something that is a little different from the harbor seals that you don't see as much in terrestrial wildlife. We really pay close attention to their umbilicus. So they'll have that umbilical cord after they're born. And then that cord will dry up and fall off just like a human within about a week or so. And then they'll still have that open or patent umbilicus for about 10 to 14 days. Okay. And we keep a close eye on that and monitor it for any signs of infection, because that umbilical cord can act as a wick almost, where it can transmit bacteria outside to inside of the body. So we check that twice a day. We clip around it on admit exam, clip the fur around it just to try and maintain a little bit of hygiene, make sure it stays nice and clean, and make it a little bit easier to identify if there's any sort of infection. And then we also have a betadine gel that we put around it to help it from getting infected. Okay. Or prevent it from getting infected.
Okay, these are going to be simple questions for you, but from someone who's never done this or know what it looks like, where do you draw blood?
Yeah, so faucets are convenient because it's much easier to draw blood on a faucet versus an otariad, so a sea lion. Okay. So the faucets have what's called an extradural intravertebral sinus. Okay. So essentially their spinal cord ends fairly far cranial, like in their thoracic vertebrae, so in their chest. So their spinal cord ends really quite close to their head compared to terrestrial animals. Oh. So when we draw blood on them, we have them in sternal recumbency on their belly, and we palpate their hips, and we go. So from their hips, you go onto straight midline, and then you count the vertebral spaces. So you can feel the gaps in between the vertebrae. So you count 2 to 3 vertebral spaces cranial or towards their head, and then you can stick a needle in perpendicular at a 90-degree angle between those vertebrae. And there's that sinus there, which is, so it's not a true vessel. It's more of like almost a pooling of blood kind of. Okay. And you can stick a needle in there and get a really good blood sample. You can also give injections there, IV fluids. So it's very convenient to be able to get blood from them.
Yeah. Oh, I'm so glad I asked.
Yeah.
So glad I asked.
Yeah.
Another question I have, which also may be very simple, it's just that I just don't know harbor seals, is can you sex them? Do they have external genitalia, or do they have visible differences between male and female, or how do you sex them?
Yeah, harbor seals can be a little bit trickier because even as adults, they're not sexually dimorphic.
Mm-hmm.
So, you can tell the difference between adult California sea lions, males and females, and northern fur seals versus harbor seals. You can't even when they're an adult. Also, phocids or the true seals have they have hypodermic testes, so their testes are within basically their body wall. They don't have a scrotum.
Okay.
So that can also make things trickier. Whereas the sea lions do have scrotal testes, so it's a little easier to tell that way. So the best way to do it is to see how many holes there are. So look to see is there anus and vagina, or if they're on their side. You can also look for the prepuce or the penile opening in the male.
Sure. Okay.
So the males you have the prepuce. You can also sometimes palpate the ospenis.
Okay.
As well. So yeah, but you do have to get in there and look for the most part, unless they're laying on their side and you can actually see the prepuce. Okay. But otherwise, you're spreading their flippers.
All right. Thank you.
Yeah.
Thank you. All right. Let's continue. I keep interrupting, but let's continue on this scenario.
Oh yeah. No, that's let's see. I think we left off at umbilicus.
Yes.
And then we also just kind of examine the animal. Like I said, while we're at the end, the butt end, we sex it. It's not uncommon for them to come in with wounds on their rear flippers for whatever reason. That seems to be where we'll see a lot of bite wounds from, like I said, domestic dogs, wildlife. So we take a really close look at those and make sure that if there are any wounds or any signs of infection, then that may be something we want to follow up on with imaging or radiographs. And yeah, I think that's about it for the initial admit exam. And then what we find on that exam kind of dictates where we go with that animal. So whether we need to take radiographs of their chest because they may have pneumonia or they have harsh lung sounds, or radiographs of their rear flippers to see if they have any fractures or kinds of osteomyelitis or bone infection.
Mm-hmm. Mm-hmm. Okay. So, Casey, what direction are we going with our scenario? You came up with the scenario, so
we'll just go the most common direction. Usually those animals, they might be placed on some antibiotic or something like that, just to make sure their umbilicus doesn't get infected, or if they've got wounds. And then they're going to go into where basic husbandry care, where they're being fed anywhere between 3 to 5 times a day, tube fed, and then once they've hit about that 4-week mark, something I don't think either one of us mentioned is that so many of them do come in just a day or two old. So, we've got kind of a little bit of a length of time before they're ready to go into what we call fish school, which is the time period of their life where they would be starting to be weaned from mom. It is kind of a hard wean. She sort of just says, good luck, kid. And she's out after nursing for a while. Okay. So we know they follow mom around and see her eating and foraging and stuff like that. And they start to pick at little shrimp and things like that as they get a little bit older. There's not as much of that luxury in rehab. So there's no one to really follow around. There's not any little shrimp. So we go through this process of fish schooling them, teaching them that fish are food and this is how you're going to eat. On a rare occasion, we will get the luxury of where we just toss in a fish and somebody slurps it right up, and we all are very excited. But in general, it's a little bit of a process, anywhere from a week to 2 weeks before they figure it out. Everybody has a little bit of a different learning pace, and we do different things from allowing them to play with the fish, maybe injecting air into it so it floats and it's intriguing, dragging it around with tongs or on a string to kind of ignite that prey drive. Mm-hmm. And even sometimes if we have older harbor seals at the facility, we will put the younger ones that aren't eating yet in the pool to observe the older ones and what they're doing and hope that will kind of get them going in the right direction. It does require a lot of patience. Every patient is different, so you got to just bite your tongue and hold your breath until they get there. But I personally have not seen one that never got there. I don't know if Michelle has or not, but they've all managed to at some point figure out that fish is food.
I've had 2 and it wasn't a happy ending. Yeah.
Oh, yeah. That's
pretty rare though. She's rehabilitated thousands of animals.
It's not common. Yeah. Mm-hmm. Yeah. It's not common.
With and I'm just thinking husbandry now. So you've been tube feeding, it's in a smaller area, maybe with a little water in it, maybe not, depending. And then do you, when you are, as they're getting older, do they get to swim a little bit and then go back to that space, or do they graduate into larger containers with water? How does that look?
Yeah, it's a really good question, and people often tend to forget this, but harbor seals are born knowing how to swim in the big giant ocean. So we
Wow.
can actually pretty much as soon as they're, Michelle says, okay, they're stable, we can start putting them in larger pools, deeper pools, and letting them swim as much as they can handle. Now, sometimes that might not be very much at first if they aren't able to regulate their body temperature or they're just weak, that
Mm-hmm.
sort of thing. But in general, we want to get them in the water and swimming as quickly as possible. And then they will start to go out to those larger pools as their health deems that they can.
Okay. Are they kind of social? I mean, is it, except for when you said you're fish school and we might put them in with an older seal that already sort of knows how to hunt. To learn, do you ever put them in larger groups as they get older, or are they pretty much, unless there's a specific reason, pretty much on their own?
Yeah, Michelle, you want to speak to their sociability?
Yeah. So, at least in the wild, harbor seals are not quite as social as some other species of pinnipeds. So you'll see, sea lion rookeries, and they'll all be piled on top of each other.
Mm-hmm.
Harbor seals don't like to get quite that close. So without trying to anthropomorphize, I think that some of those harbor seal colony regions, they're good spots for harbor seals. And that's why there's multiple harbor seals there.
Mm-hmm.
So they're not necessarily there because they're socially interacting with each other. There are other species of pinnipeds that after mom weans them, they'll form, we'll call them wiener pods, where they'll kind of hang out on the beach, explore the tide pools together.
Okay.
Whereas we don't tend to see quite as much of that behavior in harbor seals. So they're a little bit more, I don't want to say a solitary species because they do tend to hang out in some more areas and in groups, but we don't see quite as much of that social interaction between harbor seals that we do in some other pinniped species, although they do kind of hang out in a group, just at a distance from each other.
At a distance, it's a different type of social group.
Exactly. So here in rehab, because we have two bigger, deeper pools that we put the animals in, especially once they're eating on their own and free feeding.
Mm-hmm.
So because we have two, and we will typically have far many more seals than that, they do end up spending a fair amount of time in the pool together, and we do see them interacting with each other. We see them interacting with enrichment items and things like that. So that just really makes it kind of a more stimulating environment for them.
Yeah.
To have conspecifics to hang out with, likely to maybe do a little bit of learning from, as well as some of those enrichment items as well.
Excellent. One other thought, especially since you are often having to keep them by themselves and tube feed, so you're really, you're interacting with them pretty closely, at least at first. You have to worry about what we have to worry about with birds and some mammals, the misimprinting or the imprinting on humans. Is that a concern?
Yeah, it definitely can be. There are certain species we worry about that a little bit more than others. Harbor seals tend to be a little bit more shy and flighty. So even though we do everything that we can still to minimize that habituation. So we try to minimize handling, make sure if the animal is being fed 3 to 4 times a day, that we're combining other procedures if they need medications or fluids, that we're doing all of that at once to minimize handling stress and likelihood of habituation. All of our volunteers, as well as our staff, are well aware to not talk around the animals, to try and be quiet, to get in and out of the pens, as quickly and efficiently as possible. When we're doing our kind of mass feeds or group feeds where we throw a whole bunch of fish into the pool, we toss the bucket into the pool and then we step out of eyesight so that way, once the animals get their medication and we confirm that if they have medication in a fish, then we step away so that way they can feed and be left alone. So yes, that is a concern I haven't seen as many issues with the harbor seals habituating as California sea lion pups and Stellar sea lion pups, likely just because of their differences in life history.
Sure.
But it is something that we really take every precaution to eliminate that from happening.
Okay. Excellent. Thank you. Yeah, there's some certainly terrestrial species you have to be very careful about that as well. So that there's a lot of similarities going on here. Okay, so what's the next step? So let's say we have a pup that is doing pretty well in fish school. Casey, what kind of fish are you feeding?
It's a good question. Generally herring, because it's commercially available, cost effective most of the time. So it's but in the wild, harbor seals will eat up to 60 different species of fish. So they're kind of opportunistic feeders versus focusing just on one species. But that's kind of what we can get our hands on. Of course, our food does have to be all restaurant quality, human grade food. Each fish is inspected before it's given to the animal. Make sure it's not got any broken skin, obvious parasites, smells funny, looks funny, right, eyes missing, any of that kind of stuff. Each one is inspected for before it's fed out. So once they have gone through the fish school process, they're eating fish. Like Michelle said, we're doing those toss feeds where it's clear they're competing well, they're gaining weight. Hopefully they're interacting with some of the enrichment items. We've mentioned that before. Got quite a few different things that they can explore, which is nice, so that their pool isn't just this stark hospital room. Since they're going to go out into the ocean, that's extremely dynamic with lots of things to explore. So it's good for them. And then hopefully once they hit about 20 to 25 pigs, we're going to do a release exam, which is kind of a repeat of what Michelle talked about through the intake exam. We're going to tag them, which means they're going to get little flipper tags that are pierced through their webbing of their rear flippers. The females are going to be on the right because women are always right, and the boys are going to be on the left.
I love it. Easy to remember too.
Yeah. That tag will stay on, hopefully, for life, so that if they show back up again, there's some way to identify them. But while they're in rehab, they also have a little dot on their head, a bingo chip that we glue to their fur, because that helps us when we're looking at the pool and there's 12 of them in there. We can know who was who. Harbor seals, you can identify by their markings. They are individual, much like our fingerprints, but that can be hard to do when they're all moving and in a pool together. So that little chip will typically stay on their head for maybe anywhere from a week to apparently about a month. We just had a recite of a patient that was released back in January that it still got it on its head. It was just recited the other day. So that was kind of interesting. I was like, wow, that's some strong glue, but they molt once a year, so that should fall off.
Oh, sure. And obviously the glue that you're using isn't bothering their fur.
Correct. Yeah, no.
It's inert, so.
Yeah. And then once Michelle says they're good to go, everything looks great, then they will be released, typically within about 20 to 30 miles of where they were found. And, in Washington, sometimes that can be challenging, depending on if we're going back to the outer coast or up to Bellingham. We take animals from all over the state. So, but they do move around. We know that they will, just because you drop it off in that one area doesn't mean it's going to stay there.
Right.
Move around. So.
Right. Okay. Do you have to, for release, I'm going to go back to getting ready for release in a minute, but for release, do you have to think about, and maybe not so much since these are opportunistic feeders, like time of year you're releasing, or if there happens to be a fish kill event or something like that? And I don't know how much that, I know that sometimes those can happen in the ocean. They definitely happen in inland lakes, and we have to be a little cautious sometimes about releasing if we know that there's been a big fish kill or something like that. So what is that? What kinds of considerations? You said parameters, you try to release them within a certain amount of space of where they were found, but are you thinking about time of year or anything like that?
Yeah, certainly. Later in the year, we might want them to be a little heftier, maybe a little bit more body weight on them if they're being released later. The other thing I think that maybe we do have to take into consideration a lot in Washington is fishing. So if they're, open fishing season, then we want to maybe not choose that area right where there's a whole bunch of fishing going on, increasing their chances of either interacting with gear or people. So those are definitely two of the big things. Michelle, if I don't know, you speak to the rest of that part.
Yeah, I think we're fortunate in Puget Sound because there's quite a variety of fish and for them to forage on. But that's definitely something to take into consideration when you're talking about pups, like a naive animal. And there are other parts of the country, even like on the West Coast here with California sea lion pups. Depending on the time of year they strand, they really can't be released until spring. So if you have a California sea lion pup strand that's 6 or 7 months old in November, that animal really has to stay in care, at least is mandated by NOAA, until we start to see some of those fisheries become a little bit more abundant. So the anchovy and sardine fisheries in the spring. Okay. So it kind of depends on which part of the coast you're talking about and what species, but it's definitely something important to take into consideration.
Okay. So what are, release criteria? We talked a little bit about they need to be at good weight. They need to have passed fish school, right? And what other things are, I'm sure physical exam needs to be done to make sure that they're all healthy. Is there anything else that is different with harbor seals or things that you consider?
Something else that we're mandated by in our permit is the animal needs to be off antibiotics for ideally 2 weeks before we release them. Mm-hmm. Sometimes there's a little bit of wiggle room on that, but we want to make sure that because of any issues with antibiotic residue or things like that they're off antibiotics before we're releasing them as well.
Excellent.
Also, we want to make sure, especially if we have these naive pups, that we're releasing them in a quiet area with a haul out space. So we don't want to just drive to the middle of Puget Sound and dump them in, because that can be a little bit disorienting. So we want to make sure that these animals have a place to haul out and rest and get their bearings. And so that and also in an area that they are less likely to be disturbed by humans.
That was the first part of my discussion with Dr. Michelle Rivard and SR3 co-founder Casey Mclean. Be sure to stay tuned for part 2, where we get into more detail about the release phase for harbor seals. We will also get into another animal SR3 commonly sees, the California sea lion. Thanks for joining us for another episode of Wildlife Rehabilitation from Rescue to Release Season 2. Wildlife Rehabilitation from Rescue to Release is a production of Partners for Wildlife, working hand in hand with wildlife rehabilitators and veterinarians to improve the welfare of orphaned, ill, and injured wildlife. Our executive producer is me, Gail Buhl. I'm the Partnership Coordinator for Partners for Wildlife at the University of Minnesota College of Veterinary Medicine's Raptor Center. To learn more about the Raptor Center and Partners for Wildlife, visit raptor.umn.edu. Our producer is Kirk Clockey. Special thanks to our guests Dr. Michelle Rivard and Casey Mclean, SR3, Partners for Wildlife, and the Raptor Center at the University of Minnesota College of Veterinary Medicine. And that's our show. Hope you'll join us again next time.